Speaking of which, I'm delighted to welcome to the virtual stage James DiNicolantonio, Director of Scientific Affairs at AIDP. Thank you so much for joining us, James. Thank you for holding off a few moments while we had those technical issues before. You will get, obviously, we'll ensure that you get your full runtime as well, though. Hopefully James is ready to share screen. Yeah, I can see it going. There we go. Thank you so much, James. Pleasure to have you with us.
Thanks, Nathan. Can you do I sound okay? Can you hear me?
You sound great, yeah. And you're going to be talking to us about precision prebiotics for diverse health conditions. I'm going to hand straight over to you.
Great.
Thank you so much, James.
Dr. James DiNicolantonio. I'm the Director of Scientific Affairs at AIDP. And as Nathan mentioned, I'm going to be discussing precision prebiotics, and just wanted to sort of quickly cover the importance of the gut microbiome in regards to both gut health and systemic overall health. And so what you see here on the right is a healthy gut, and then to the right of that, a leaky gut. And essentially, we know that our bacteria determine inflammatory signaling and how well the mucus layer protects the intestinal cells. So essentially, when you have gut dysbiosis, you can have a breakdown of the mucosal layer and a breakdown of the intestinal tight junctions, which can lead to essentially proteins spilling into our blood. And that leads to something called endotoxemia, or essentially LPS from bacteria, which can lead to a whole host of health issues. So the key here is essentially gut health determines overall health and will actually affect every single organ, which is why a lot of issues related to the gut can actually present as different issues throughout the body. So what you see here is quote unquote, different types of fibers and whether they ferment or not and where they ferment in the actual gastrointestinal tract. So what you can see here is pectin has a good fermentation in the colon. Cellulose does not ferment at all. Humans lack cellulase in order to break it down. So even though this is considered a quote unquote fiber, it is not a prebiotic. There's fructooligosaccharides and galactooligosaccharides, which you can see here ferment very well in the proximal colon. And then there's something called inulin resistant starch, which also ferments very well. And then your typical starches and sugars, which don't ferment in the colon, but actually will ferment in the intestine, which can lead to more sort of IBS type of issues. So what we see here is what consumers are actually using when they take what they're using for the prebiotics. And obviously the most important would be gut health or digestion, but they're also using it for immunity too. So they understand the gut immune health connection, but even bone health as well. And of course, regularity. So for constipation, but there's even trends for brain health as well in regards to the gut brain connection. So what's the difference between sort of like a typical fiber and a precision prebiotic? So essentially, if you're using, typical fibers, you have to use a high dose, and then it's going to cause a lot of fermentation, which can lead to bloating and gas. And so really what precision prebiotics offer is not only the lower dose and the decrease in gas formation, but if you have gut dysbiosis, if you just give a typical fiber to someone, that can start growing the bad bacteria and actually make gut dysbiosis worse. So with precision prebiotics, they can selectively grow the good gut bacteria. And so it's really the future of gut health is figuring out which precision prebiotics actually help to selectively grow the good gut bacteria. So one of them being Prebiotics. Prebiotics is a low-dose xylo-oligosaccharide. There's actually over 12 published clinical studies on this ingredient, numerous human clinicals, and I'll go over some of those in the upcoming slides. But what's unique about Prebiotics is that it selectively supports bifidobacteria, and the effective dose is simply just 1 gram. So this is sort of allows you to dose with multiple ingredients with Prebiotics, and also reduces the risk of side effects because you can use such a low dose. And then it also decreases the risk of actually enhancing gut dysbiosis because it selectively grows the bifidobacteria. So what you can see here is actually how Prebiotics increases both bifidobacteria and lactobacillus. And there's actually not just increases in the colon, but also throughout the intestine. What we also see here is Prebiotics being able to improve the gut barrier function, which is likely due to the improvement in good gut bacteria. There's also human clinical studies testing Prebiotics showing reductions in total cholesterol, decreases in triglycerides, and even improvements in glucose. So there's certainly this gut metabolic health connection as well, because when you improve gut health, you reduce inflammation, and that inflammation or reduction in inflammation can actually improve lipids. And we see this again, even in type 2 diabetics as well. Prebiotics is able to significantly reduce blood glucose, A1C, which is a 3-month measure of average glucose levels, and even fructosamine, which is basically a 2-week measure of overall glucose levels. There's also significant reductions in inflammation with Prebiotics. So here you see basically interleukin-1 beta and interferon gamma. So it's reducing these inflammatory cytokines. And we know there's this connection between good gut bacteria and the production of these short-chain fatty acids. And so the increase in concentration of short-chain fatty acids has been also shown to reduce inflammatory cytokines. So this might be one of the mechanisms for why precision prebiotics may actually reduce inflammation. So Prebiotics has been tested either on its own or combined with bifidobacterium in a double-blind randomized controlled trial. And here were some of the noted benefits: that there were significant improvements in mean bowel movements, increases in bifidobacteria, increases in good cholesterol, and then decreases in inflammation or markers of inflammation, and even improvements in quality of life like vitality and happiness. So that is, we're going to shift over now from Prebiotics to another precision prebiotic. This is called Livox. This is actually a whole kiwi fruit powder from the gold kiwi fruit. And basically what's unique about Livox is you're not getting any of the skin or the seeds. You're just getting this nice whole fruit powder. And so it's processed in a pharmaceutical grade way. It's a freeze drying method, so it retains all the antioxidants and nutrients. It's actually fairly high in vitamin C as well. And what's unique about Livox is that it has the ability to selectively increase another healthy gut bacteria called Faecali prausnitzii, or F-Prau. And we can see actually that F-Prau is deficient in numerous disease states and actually has numerous beneficial effects. And F-Prau, similarly to other good healthy gut bacteria, helps to ferment the fiber, increase the production of butyrate. And many disease states are associated with a reduction in F-Prau. So what's also interesting too is there's no probiotic to give someone F-Prau. So really the only way to effectively raise it is to take something like Livox, which can, as a prebiotic, increase the growth of this good gut bacteria. So there's been 2 human clinicals looking at Livox and seeing if it can increase F-Prau. Now, this was a study in functionally constipated individuals, and essentially Livox was able to double F-Prau concentrations. And we saw the same effect as well at a lower dose at just 600 milligrams of Livox. This was in healthy individuals who had complaints of constipation. And again, you see basically a doubling in F-Prau concentrations. Now, what's really interesting too is we're seeing this connection between a reduction in F-Prau and patients with COVID, even 30 days after resolution of disease state. So there's this connection and a potential that trying to help gut dysbiosis and the depletion of F-Prau may have potential in COVID patients. Now, I talked before how gut health can affect more than just gut health. It can affect even skin health as well, because you essentially have this increase in LPS systemically, which can actually lead to inflammation in the skin as well. And so what we see here is if you improve gut dysbiosis, there can actually be improvements in skin health. So this brings me to Beauty Oligo, which is a low glycemic galacto-oligosaccharide prebiotic. And this study actually took Beauty Oligo and looked at albino mice and basically irradiated them for 4 days with ultraviolet radiation to see if there could be any benefits on skin health. And essentially what you can see here is the skin water holding capacity was significantly increased with Beauty Oligo, and the water loss was significantly reduced. And this led to improvements in wrinkles as well. And so this is sort of, by improving the water holding capacity, you can actually improve skin health with a prebiotic. What we also see as well is there's these enzymes called matrix metalloproteinases that can break down the collagen in the skin. And then there's these inhibitors. They're called TIMPs, TIMPs, which can inhibit those basically proteases that can break down the collagen, and which leads to increase in wrinkles. And we see here that Beauty Oligo is able to increase the inhibitor of these matrix metalloproteinases, and this is why we see improvements in reduced wrinkle appearance. There have been clinical studies too, looking at Beauty Oligo. This was in 84 healthy Korean volunteers, ages 30 to 69. The dose was 1 gram twice a day. And essentially we see the same thing as we see with the animal studies. There is basically a decrease in water loss and an increase in water retention of the skin. So there's an improvement in skin hydration. And this leads to reductions in appearances of wrinkles as well with Beauty Oligo. This was another study actually looking at hyperpigmentation to see if basically Beauty Oligo could help increase the whitening and reduce the redness of the skin. So this was a randomized double-blind placebo-controlled study in 80 individuals looking at 1 gram of Beauty Oligo twice a day for 12 weeks. And the main outcomes were the melanin index and the erythema, which is essentially redness index. And essentially what we see here, this is, again, the melanin index significantly decreases. So there's an improvement in basically the whitening of the skin, and the redness, which is the erythema index, was also significantly improved with Beauty Oligo. So essentially, using precision prebiotics, we can not only boost good gut bacteria, which can lead to a reduction in inflammation and improvement in lipids and glucose, but we can also use these things for boosting immune system and even improving skin health. And that is it. Happy to take any questions.
Hi, James. Thank you so much for your presentation.
Thanks. Yeah.
Let's see, we've got some questions coming in. If you do have questions, please do place them down in the Q&A box down below. And we will be looking at them now. So James, we've got a question here about the fermentation index. What are the merits of that?
Yeah, I think when you look at it, I think there's good merits. And what's interesting too is this brings up another important point too. When you're looking at the fermentation index, what you see with a lot of the starches and a lot of the sugars, you get these large spikes, which is what can lead to a lot of the gastrointestinal issues. So precision prebiotics, if you can have sort of like a lower fermentation, not so high, that's more delayed as well, that can actually give you the beneficial effects of the short chain fatty acids without the side effects. So you almost want to look at that index as well to see if you're seeing not such a large spike, but something that's a little more like curvilinear.
Sure. And I guess that's also one of the benefits of such a low dose as well, right? You know,
exactly.
Compared to say some of the other more traditional prebiotics where you're looking at doses of, let's say, minimum of 10 grams, and you know, some studies for certain effects up to sort of 20, 30 grams and more.
True.
Yeah. On that, it'd be great to sort of have your input on what you've seen and experienced within the prebiotic space in terms of that low dose, and how that's been utilized in the real world. What are you seeing? You said it's perfect for sort of multi-ingredient formulations and things like that. So where are you actually seeing that being used, and how is it being formulated?
Yeah, that's a great point. And so we're starting to see a lot of companies actually combine Livox, Pretix. We also have a whole fruit, green kiwi fruit called Actazin, which is actually really good for constipation. So sort of taking this synergistic approach and combining precision prebiotics together to sort of help throughout the entire gastrointestinal tract, the health of the whole system, and to sort of pick and get the selective benefits of each one sort of gives you this more holistic improvement in health.
Great, thank you so much, James. One of the other questions that we've got in is on the sort of. It seems like you guys are focusing a lot on prebiotics versus say probiotics. So what excites you most about this category, and where do you see the science evolving in the prebiotic space?
Well, it was interesting that we've been discussing, gut bacteria throughout the, more than just throughout the gut, right? But the lungs, the skin. And so I think we're starting to realize that this affects the whole system. And so it's not just, we've sort of focused on prebiotics more on constipation. And I think what excites me the most is its applications throughout the entire body.
Excellent. Okay, I completely agree. It's a crazy and exciting world out there. After some of the developments that we've seen in the gut skin axis, what's your take on skin microbiome formulations that people are using in cosmetics? Do they require more research, or are some possibly just having placebo effect, for example? Is there differences topical versus sort of through the gut skin axis, and what can you say on that?
Well, what I can say is that we do know that a lot of traditional topical cosmetics can actually have a harmful effect on the skin microbiome, which is potentially why there's a lot of increases in like eczema, psoriasis, other things, especially in women who use those type of cosmetics, because it's harming the skin microbiome. And so I think moving forward, there may actually be more clinical studies looking at this issue and to see if you can actually improve the skin health that's occurring through the use of these topical agents using actual precision prebiotics.
Excellent. Thank you. What are some of the practical benefits and challenges of the sort of the clinical trial process and the research process when you're looking at combinations of these different prebiotics? Does that sort of impact things when you're thinking about the design and execution of these trials?
Yeah, I think, well, I would say, so obviously there's several benefits, and then there's, potential negatives in regards to if you combine a bunch of different precision prebiotics, it's like, well, which one is working on what? Which is why we previously studied each precision prebiotic on its own to figure out what's the exact mechanism. But then now the benefit of combining these are multifactorial. So you see, this is where you can get into not just the combination, where let's say you combine Pretix for the increase in bifido, and then you get the increase in FPRA with Livox, and you have better constipation effects with Actazin. So you're starting to get this multiple whole gut health, basically symbiotic. But you can also start testing different doses too. So you can start actually lowering the dose when you combine different precision prebiotics.
Yeah.
So that's where it gets kind of interesting too.
Yeah, and this is something that, again, it's come up a few times in our conversations today, and I know it's something that a lot of people are very interested in. Is sort of this idea of, rather than maybe taking one prebiotic of the more traditional fiber type, let's say, or something at 12 grams, 15 grams, you can combine various other prebiotics at a lower dose, and actually you get a real nice effect there, and a lot of like you say, almost a symbiotic effect. So it's an interesting area for sure. We have had a question here though, asking whether we're in danger of sort of magic bullet thinking almost, and given that the microbiome is so central, are we at risk of getting ahead of ourselves on the science, especially when it comes to things like prebiotics and precision prebiotics?
Well, I think so. Looking at it myopically, you can get into trouble, but I think just the clinicals, the results speak for themselves. So rather than always super like focusing on mechanism of action, that's why you do a clinical study to see if it actually improves an outcome. And you can try to figure out all day like how this is working, but at the end of the day, the focus on the actual result is what you really want to look at. And so you can get ahead of yourself if you start myopically focusing on, well, it must be this bacteria that's causing this benefit. But I think it's more important to actually just test it out in a human clinical. And if it works in an outcome, then I think you're not getting ahead of yourself. Then you're just using the data. The data is speaking for itself.
Yeah, and yeah, that's one of those really interesting areas where obviously when you're talking for hours on end like we are today about various aspects of the microbiome, and you can get very bogged down, I guess, in sort of shifts in bacterial species and different metabolic outputs and things. But actually, if you put something in and you get a health outcome on the output, then everything else in the middle is obviously it's interesting mechanistic data, but is it really anything other than that? Okay. We've got another question here asking about if there are microdose precision items, are there upper limit thresholds, considering sort of some of the synergies that you may be seeing? So, and again, this is something that I guess came up in one of the other presentations where we were talking about the idea of dosing different prebiotics together, but actually some of them may end up targeting the same species or the same sort of areas. So are there upper thresholds, let's call them?
That's a great question. And actually, we've done a bunch of studies looking at higher doses around safety. So if people are worried about, well, is it safe once you start combining all these different precision prebiotics? We've done tests up to 8 grams of Prebiotics and Livox up to 2.4 grams. But then we lowered the doses all the way down to 1 gram for Prebiotics and 600 milligrams for Livox. And both of those showed benefits. So we have a very wide threshold in regards to safety and efficacy.
Did you see, just out of interest, did you see sort of dose response on those studies? Or was there sort of a flattening as you went to higher doses, sort of almost a threshold of benefit?
Yeah, I think so. With Prebiotics, there does seem to be better benefits in regards to like metabolic health. And so, right, like blood lipid, blood glucose lowering as you go from like 1 to 8, but we still see benefits even at low doses.
Sure. One last question that we've got here as well, asking about sort of people who've been lumping together prebiotics as fibers and sort of using them interchangeably, which is clearly quite inaccurate. I mean, one of the things that I talk about quite a lot, and I know a lot of people that also talk about quite a lot, is how clearly not all fibers are a prebiotic. Not all fibers have a prebiotic effect. Not all prebiotics are fibers either. When you look at some of the things like some great data on things like polyphenols, for example. So how can we as scientists, as industry, as stakeholders in the microbiome space start to combat this and better educate people, or does it even matter, I guess?
Well, I think that's what we're doing here, right? Is basically trying to let people know that just because something even is a prebiotic and it does ferment, that doesn't necessarily mean it's beneficial, because I think a lot of people automatically assume that fiber is beneficial and is a prebiotic, which is not necessarily true. And that if it is a prebiotic and that it provides an increase in butyrate and things like that, that's automatically going to be a beneficial thing for their patient. And since gut dysbiosis is a huge issue, I think shifting over to, does this prebiotic actually grow good gut bacteria and selectively do it and not grow bad gut bacteria. I think that sort of needs to be the focus.
Sure. Yeah, very interesting. We've got one final very quick question, then I'm going to ask you to just sort of maybe give us a few wrap-up points as well. A slight curveball, I guess, but have you had any plans to look at or seen anything looking at things like garlic or onion powder, particularly that sort of the tasteless ones and things like that? Is that an area that you guys have been looking at? Obviously, you've been looking at all sorts of other fibers and prebiotics from other plants.
Yeah, so there's definitely some interesting data on compounds in garlic and onions and some of the prebiotics that they hold. We're not investigating anything around that, but that's definitely, a potential opportunity.
So if the person who asked that question does have interesting things there, then maybe get in touch. Okay, James, we're sort of coming up to time now, but I would ask if maybe we can just ask you to maybe give 2 or 3 points, sort of a key takeaways. If people only remember a few bullet points from everything that we've discussed and everything you presented, what would they be?
I think there's probably 4 different key points here, is that the differences between precision prebiotics and your typical prebiotic is that it's a low dose, less side effects, clinical efficacy in regards to selectively growing good gut bacteria and not promoting gut dysbiosis. If you remember anything, those 4 things are super important.
James, thank you so much for your presentation today and for taking the time to answer so many of those questions. And thank you to everyone for sending those questions in.